know we are in TUMS Education Week Congress, and we have some international webinar. And in this part, we have this opportunity to invite dear Professor Elizabeth Kachur from New York, and she kindly accepted our invitation, and she will talk about the OSCEs and all aspect of this informative, assessment tool for assessing the performance of the students in the clinical setting, in the real setting, and any others. Okay, let me just introduce a brief introduction about Dr. Elizabeth Kachur. She is a director of medical education development of Global Consulting in New York, and she is expert in the professionalism as well as the OSCEs and assessment as well. I stop my speech and invite Dr. Elizabeth to start the meeting, and we are all here about your lecture.
Well, thank you very much for the invitation. I feel very honored to be here with you all. And I will start and end this session with some personal note. And so to start out with, my relationship with OSCEs. The first OSCE that I organized was in 1986, a long time ago. And it was at that time I was working at Albert Einstein Medical School, and they were going through some curriculum changes. And my task was to develop pilot various new developments, and OSCEs was one of them. And so I organized the first OSCE, which was at that time 25 stations on 4 floors of the medical education building. It was pretty wild. And since then, I never did a 25 station OSCE again. But it definitely, as crazy as it was, it definitely hooked me to the idea of organizing such challenging assessments or teaching tools. So that is to start with. Let me show you my slides, and I hope we will have some more interesting discussions about this topic. Okay, so I assume you can see my slides?
Yes, yeah, Professor, it's okay.
Okay, excellent. Okay, let me put it into the presentation mode. Okay, so this is what I hope. So this is me, and this is what I hope we will be addressing in the next hour. So first, a little bit background about OSCEs, and then we'll talk about planning and implementing OSCEs. And at the end, some summary questions for you. And as well as I hope you will all walk away with some useful take-home points. So these are the objectives. Hopefully, by the end of this session, you will be able to list some strategies for making stations feel real, feel more real. Of course, it's a simulation-based training, but we do want to make sure it is not artificial. Experience is artificial, so that the translation between the simulation and the real world is easier. Also, hope we will discuss some strategies to enhance psychological safety and reduce cognitive overload and bias, which are some of the key challenges OSCEs have. And finally, I hope you will walk away with some opportunities, getting some new ideas for your local OSCE implementations. So OSCEs. OSCE stands for Objective Structured Clinical Exam, but more recently, there has been a change and a move towards calling it observed rather than objective, because it's not always completely standardized, not always completely objective. And in addition to it being an exam, there's also more recent developments. So it's not actually been so recent, but it's also being used as a formative assessment. So it's more like an exercise or a learning experience. And in terms of standardized patients or simulated patients, which they are called in most non-US countries, that also has been changed more recently because we are talking about participants. Standard SPs are not just used for, not just employed and engaged in portraying patients, but they're also portraying healthcare providers or learners or OSCE. The use of OSCE has expanded significantly. So SP now stands for standardized participants. Over the years, the number of OSCE publications have been increased significantly, as you can see on this graph. And actually, the first mention of OSCEs was in 1975 by Ronald Harden. And so this is, the explosion of OSCE publications that deal with OSCEs. But actually, I think it's an underestimate because over the years, many different terms have been used to describe the same thing, OSCEs. So MSE, multiple station exam, CSA, clinical skills exam, the assessment or exam. There are really many different terms that are used and that make it very difficult for anyone who is doing a literature search on OSCEs to really identify all the references that are available. Okay, so I told you a little bit about myself, and maybe you can share how many years have you been involved in OSCEs as a learner, as faculty, or as an organizer? And I have to now start the poll. I hope I can do this here. Let's see. And please, yeah. Okay, so here is the poll. And if you can respond to it, please. I have to launch it, sorry. Here we go. So if you could respond to it now, how many years have you been involved in OSCEs? In any form, less than a year, 1 to 5 years, 6 to 10 years, or more than 10 years? Okay. I see several people have answered already. Okay, maybe we can get a few more responses. All right, so maybe I'll stop the, okay, it's getting more varied now. But I think it gives us a good idea of what range of OSCE experience you all have. And let me just share the poll. Let me share the results. Can you see the results?
Yes, yeah, Professor.
Okay,
Yes.
very good. So here we are, and I can see that there are really a variety of experiences out there in this group. So that will be very helpful also for any future discussions to so you can share your experiences. Okay. Right. Okay, back to the slides. Okay. So okay. Here we go. So now about OSCE, creating an OSCE, and we'll start with some issues that relate to planning, and then we'll address some issues that relate to implementation. So planning first. As anyone who has organized an OSCE knows that there are many different elements to it. Of course, there are the organizers, and I can see that some of you are organizers as well. There's a variety of paperwork that needs to be done, a blueprint, instructions, schedules. They do require quite a bit of thought in order to make it as effective as possible. And there are also quite a lot of people involved in OSCE. So there's this SPs, faculty or tutors, and staff, other people who maybe do the timing or are involved in various other aspects of this rather complex event. And of course, there are the learners. So keeping that in mind, it's a complex event, but it can be extremely helpful and useful in either assessing skills or teaching them. In addition to the many people that are involved, it's also important to take advantage of a variety of expertise. So there's the content expertise that is clinicians, for example, who know what the topic is, who are familiar with the topic and with the material that's being assessed or that's being taught. And then there is the process expertise. So these are people who are focusing on how everything works together and how one can optimize the individual stations, the OSCE in general, the pre-brief and the debrief, the way to make this an effective training tool. And of course, there are many people who have who may be a clinician to begin with, but who have developed also a lot of process expertise. So they maybe combine both areas in one, but the point is that both are important, content as well as process. So station development. Some time ago, I put together this comparison of a book that I have been involved in, and actually we're working on our second edition now on organizing OSCEs in 10 steps. Then there is the Association for SP Educators that has put together the best practices, standards of best practice, and that's being revised, as well as some people who were involved in the licensing exams. They also put together some best practices for simulation-based examinations, particularly OSCEs. And so comparing them here, for example, in terms of station development, very important is to keep the training level in mind and to make sure that the stations are appropriate for the level learners, whether it's an assessment or whether it is a training tool. And the other thing that is also important is to keep it real, to make it's never going to be completely real because it's a simulation, but we need to make it as close to real so that people can perform provide their actual performance. It is more similar to a real life situation. So let's think about how can we make it real. There are many preparations needed to make it feel real. And there's a typical encounter, maybe a standardized patient and a learner, and very often to set up the scenario and to provide what tasks need to be completed, there's a written instructions for the learner. So that's a relatively easy way to set something up, a scenario. Some OSCE stations rely on a previously experienced encounter or previously observed situation. So they are observation-based, and they also have instructions, written instructions usually, but also having, for example, a video that illustrates what was supposed to have happened before this encounter. Is another way to make it feel more real. And the person on the video who is will then need to be the same as the person who the learner encounters in the station. And then there's another type of station that is even more challenging to put together, but it can be very powerful, and that is a personalized station. So, certain scenarios will have a different impact on different learners. So, for example, a scenario that deals with rejection, being rejected by a patient, for example, will be for a reason, may differ depending on the characteristics of the learner. So to overcome that, to make it a consistent experience of dealing with a patient who rejects you, one can again have a written instructions, and then one can identify for each learner some characteristics that would be meaningful for them. So for example, in this picture here, one would have a patient rejecting a female clinician. And if there's a male clinician learner coming to this station, they would then switch and say, I don't want to have a male doctor. So it provides some additional challenges to make it happen, but it can be very powerful. And obviously, we need to teach also our learners how to deal with such complicated and complex situations. So I showed this picture before, and my next poll question is this a clinician portraying a patient, or is this a non-clinician portraying a healthcare provider? Obviously, certain costumes will indicate whether somebody's role. And so it is very important to make sure that the SPs regularly are also fitting that role. So let me ask you now the next question, and that is here. Okay. Oh, sorry. I think I made a mistake. One more time. So let me. Sorry about that. I'm trying to figure out a way to show the question. Oh, this is the next one. Maybe I have to. Here we go. Pause. Okay. So let me finish this one and go to the next one. So is this a clinician who is portraying a patient, or is it a non-clinician who is portraying a healthcare provider? And, or are you not sure? Okay. Let's see. Any more guesses or? Well, okay, let me end the poll here and let's see what came out. So let me share the results. And can you see the results?
Yes, yes, we can.
Okay, great. So this is the result. So from everybody who responded, half of you thought it was a clinician portraying a patient, and then a little few, 30% thought it was a non-clinician portraying a healthcare provider. And that's actually the correct answer. This is a standardized participant who was utilized in one of the licensing exams by the osteopathic medical examiners. And he was just changing the costume, the gear. And as you can see, it makes a big difference. But we definitely want to, I stop sharing it now. Okay. So we definitely want to make sure that the people who are portraying the scenario, who are engaging the learner, that they are as appropriately dressed as well to make it feel real. So go here. So it's not just the dress code or the clothing and maybe some, a stethoscope or so, but it also is the way they behave, what their emotional tone is. And so this is some pictures from an OSCE station that we dealt with a confrontation of a learner because they didn't do a proper, I don't know what happened here, but they didn't do a proper examination of communications with the patient about the discharge of a patient. And so you can see on the left, the SP welcomed the learner, being very angry, sitting in a chair, pointing to the learner, but and expressing the frustration of verbally. But on the right side, you see somebody who had a very high emotional tone, who was standing and who was talking in a much stronger voice. And at the end of the OSCE, we asked the participants to, these were residents in internal medicine, to identify what was the educational value for them. And although it wasn't statistically significant, you can see that there was an increase in more in educational value if the emotional tone was high. So again, it felt more real for them. That would have a better impact on their training with this station. I said before that there's also the possibility of showing a video, a very brief video that can illustrate what would have been seen before. This is another OSCE station, also from Maimonides Medical Center, but from pediatrics. And the objectives of the station was to recognize unprofessional behavior in a colleague, and that unprofessional behavior was visible in the video. There was an encounter between a resident and an ambulance driver who wants to get a signature, but the resident is very busy and ends up really shouting at the ambulance driver. So it's a very short video, but it gives a very strong impression of what happened. So when the learner then went into the station to deal with the resident, who was the same person as on the video, they then were in a better position to discuss what was unprofessional and what the problem was and what was unprofessional about it. So more able to provide effective feedback. It's also not just the visual, but also it's important to get some input from the target group. For example, this was in a station with Drexel University in Philadelphia. And this was a station where we wanted to have, it was about anti-racism and it was about microaggressions. And we wanted to set it up so that the learner was confronted with a situation where somebody else, a ward clerk, somebody who works on a hospital ward, made some inappropriate comments to a colleague, medical student. So we needed to get some better idea about what would be acceptable, what would be meaningful for the learners. And we learned from this focus group that we had that, for example, certain words like troublemakers was not used by students. So we had this in the scenario, in the script for the SP, but it wasn't used for the students, so it didn't make sense to them. Another thing was acceptable social behavior. So students apparently avoid talking to peers about these topics. So we learned that this was also not matching. It wouldn't feel real for the learners who were coming into that station. And also, maybe it's the same in Iran. There was a reference to students watching something on TV, but apparently students in the US don't get their news from TV, so from social media. So that also would have not made it feel real. So asking the target group, making sure that it fits the words that are being used that are in this transcript will also fit and make it real for the learners. Is also important. Okay, so then we have this Yerkes-Dodson law, and maybe some of you have come across it already, but it's a very important thing to keep in mind with OSCEs. Obviously, we want to put stations together that are challenging. We want to challenge the learners to, if they're not challenging, then it would be a waste of effort and wouldn't be so helpful. So we want to challenge them. But there is a relationship between the getting the performance optimal to the amount of stress that the station would produce. So if there is not enough challenge, if there's not enough stress, then the learner will feel bored and will not perform optimally. But if the stress is too much, then they will also not perform optimally. And so finding the right level will be very important for every OSCE station. And piloting it, finding out how others at that level would perform is always another very important part, especially if it's a summative assessment, if some decisions are made about people's promotion, for example. So what could you, or what have you done to make something real? Maybe you can speak up now or add it to the chat. And let's have a few minutes of your thoughts about what you can do or have done before to make something feel real. please just speak up. That's perfectly fine. Unmute yourself. Or if you put it in the chat, someone will read it. Well,
there's no answer in the chat box yet, but if anybody has any comments or reply, they can raise their hand and turn on the microphone.
yes, if someone raises their hand, I can also see it, you know, since I'm showing the slides, it's difficult to know what's going on.
Argavan said it's a hard question, but there are no any answer or
no
sentences
easy
about that.
answers. Yes.
Yes.
But okay, I get that. We all need to work on that. It's there are no easy answers, but it's something to think about. So we can move on. Maybe afterwards you have some more thoughts at the end of the session. But anyway, we need to think about it with every OSCE station that we're putting together. How can we make it as real as possible for the learners? So thank you. It was a good comment. It's true. All right, now let's think about OSCE implementation. So we are moving from the planning to the implementation. And some of you may be familiar with these journals. They are some of the key journals in the world of simulation-based learning or simulation-based teaching, and the Association for Standardized Patient Educators. I mentioned it before, the Society for Simulation in Healthcare. They also have done a lot of work in this area of OSCEs, and also the International Nursing Association. They also have developed some standards on how to put simulations together. So in the next part of this session, I will address some of the key issues that come up over and over again in many of these journals and many of the literature that has been put together about OSCEs. One is psychological safety, one is cognitive overload, and the other one is bias. So starting with psychological safety in OSCEs, what one has to keep in mind is that it's a complex situation again. The physical environment will influence it, social environment will influence it, program design, and of course there are personal characteristics that will make somebody more or less vulnerable to feeling unsafe in a certain situation. But what's very important to keep in mind is that it's a ripple effect. So if one person, for example, the standardized participant, feels unsafe, it will make everybody else unsafe as well. And so it's really important to work on making OSCEs, as stressful as they are, as safe as possible. And also physically, the setup is important to keep in mind. Like this is a scenario from another OSCE, and you can see you could reduce some psychological safety. I mean, you can increase psychological safety. It's not reduce it, but increase psychological safety by, for example, positioning the faculty observer in a less intrusive place, so that the learner who would be on the left bottom, you see it here, would not be looking at the SPs or engaging with the SPs, but having the faculty right behind them. It could also be influencing the SPs being in such close proximity. And as you can see, he is also interfering or interrupting the OSCE station, and that all will make it feel less real. So instructions for everyone, and placing them in the right place will be important. And another important thing is to hear some best practices. It's very important to have a pre-brief. What you see here on the left are some posters that have been promoted by the Center for Medical Simulation from Harvard University. And they are put up in different simulation centers in different rooms to remind everyone and of the importance of the basic assumptions, the pre-brief and the debrief, which is also critical to enhance psychological safety. So the pre-brief needs to orient the learners to the goals and objectives, but also to the logistics, and we can talk about that later as well. It's always good to acknowledge that OSCEs are challenging and stressful, and we understand that, but also real life clinical work is very challenging and stressful. So it's something that we need to remind the learners of as well. And to emphasize, and these are the basic assumptions that you see on the left here. All learners are intelligent, capable, care about doing their best, and want to improve. I don't know whether these basic assumptions are also practiced in or mentioned or reiterated in Tehran, but it's becoming common practice to re-emphasize that the learners are trying their best, and that should also help to enhance their safety to perform it as best as they can. And debriefs are equally important, and they should also require that everybody in the debrief is engaged. So if only a few people speak up about how the experience was or what they learned, then it will not feel safe for the others to be engaged as well. So it's important that everyone gets to talk. A second important point is cognitive overload in OSCEs, and this is the definition for cognitive overload. It's the amount of information and interaction exceeds that's required in a station or in the OSCE in general, exceeds an individual's capacity to process them effectively. So this again goes to the graph that I showed before. It is important to engage the OSCE participants, but if it is too stressful, then they will not be able to perform optimally. And one of the ways that some people have tried to deal with stressful OSCE stations is to provide a trigger warning. I don't know whether that has been utilized in your settings as well, but this would be, for example, it would be an example from another OSCE. There was as part of the pre-brief, there would be mentioned that this station can trigger past experiences with, for example, domestic violence. It was something else, but you can put in anything else that pertains to the station, and can make you relive painful situations. Please remember to give yourself space to take a break from the station, and if needed, or to seek out a trusted peer and mentor to debrief after the OSCE. So this would be a way to avoid too much stress in the situation. But there are several arguments for and against trigger warnings. And this brings me to my next polling question that I have for you. And let me go to the polling question. So Going to the next one. Here we go. So, is it okay to excuse someone from going through an OSCE station that could traumatize them?
Dear
So
Professor,
please.
we couldn't see
Oh,
the
I'm sorry,
yes.
I didn't
Please
launch
launch
it.
it.
Thank you.
Yes.
Now it's
Yeah.
launched, right? Okay, good. Thank you.
Yes.
So this is a question. Is it okay to excuse someone from going through an OSCE station or that could potentially traumatize them? Or is it not? So yes, no, or maybe. Okay. I see. Okay, somebody says maybe already. Mm-hmm. Well, looks like it's split between yes and no. And maybe somebody in this group could share why they picked yes, and somebody could share why they picked no. I see we're getting more maybes.
Dr. Al-Ghawan said if they cannot go through a station, I don't think they can function in their job later.
Hmm? Yes.
Yes.
So this, I would think so too, that it would be, it could have some negative effects if someone that avoids to go through such scenarios, because in real life they will not have choices. And so the one important thing about OSCEs is that it can provide a safe learning environment. And obviously, if one has very challenging stations, like about domestic violence, child abuse, racism, whatever it may be, this can be create a difficult situation for some, but the OSCE can provide a safe environment to deal with it. And it may be necessary to have additional support for individuals for whom this can be reliving some past traumas. But it's better if it happens in the OSCE. So I would agree with the not to excuse somebody, but to make sure they go through it, but to be vigilant about the effect it has on them. But it's a controversial issue, so there is no, it's not so easy to come up with an answer, yes or no. All right, let me stop the poll now and go back to the slides. And but it's something, again, to keep in mind when you're preparing the stations. They may have some negative effects on some people, and you need to be prepared for that. Okay, to go back here to our next one. Okay. Sorry, my mouse is running wild here. Here we go. And now we can go to the next slide. Yeah, so other strategies to reduce cognitive overload. Again, the importance of creating appropriate stations that are appropriate for the training level and that are not too long or not too many. So a 25 station OSCE definitely exhausted not just the organizers, but also the learners, even though it was a good experience for them in the end. And that's why it was instituted afterwards at that medical school. But still, it one needs to keep in mind that people need a rest, maybe some in adding some rest stations can be helpful. The other thing is preparing learners before the OSCE, so having a workshop or having some readings that will make them feel more comfortable with the knowledge part of that goes into the OSCE, so that they are more able to focus on the skills. And OSCE is skill assessment or skill training program. And with these preparing the learners, the picture on the left side is from one of the workshops that are organized in one of the OSCEs I work on. And as you can see, there's lots of food on the table, so making it as relaxed as possible so that they are open to the information that they will need for when they go through the OSCE. Some OSCEs, for example, focusing on communication skills, and the level of knowledge may vary because learners go through clerkships in different sequences and so on. So one way to do that is to provide a fact sheet before each station that would fill in that knowledge gap that they may have. And that's another way to reduce the cognitive overload and to help them focus on the skills that we want them to demonstrate. And then the learner instructions themselves need to be focused and can be enhanced with audiovisuals. We already said that. So the biases. There are so many different biases. Here are just some of them, but there are many, many more. And some of you may have seen the bias wheel that you can look up on Google. And there are many more biases that we are all victims of. They're a natural part of it. We are programmed that way, but we need to keep them in check when we are dealing with developing OSCE stations, as well as when we are rating learners or providing feedback. So we need to make sure that the stations don't increase stereotyping. So that is an important thing to keep in mind. We also need to consider that during SPs and faculty observer recruitment, that we are looking for people who can maintain or control their bias as much as possible. And so rater training is very important, and it should include some reflection and calibration exercises. And in the end, when we have the results of the evaluations, we need to also look for tendencies that could reveal biases. So what very important is to know what type of rater you are. Are you a very lenient one, or sometimes we call them doves, or a very strict one, like a hawk, or are you somebody in the middle, flexible, going between both of these extremes? So I have another question for you. Thinking about yourself, what type of rater are you? And let me go to the poll. I have to stop sharing this. Go back. This poll, next poll. So, and I have to launch it. So, what type of rater are you? So this is some of the reflections that are part of rater training. So flexible, okay, very good. Strict, okay. Okay. Flexible is, of course, aiming for the accurate rater ratings. But some of us, including myself, have definitely, I'm aware of my own tendency, which is definitely I'm a dove. I'm a lenient evaluator. It's very hard for me to make to give negative ratings, although they're important. And so I struggle with that myself to not just give in to my natural tendencies. Okay, so I can see most of you are really very concerned about being accurate. And that's, of course, the goal. Sometimes we need to make sure that we are evaluating what we see, what we observe, and not, what our tendency is. But being aware of that is important. Okay, so to sum things up, okay, did I share the results? Maybe I didn't.
Yes, we can
Now I'm sharing it. Okay, so I'm sorry you
yes.
didn't see the results and I was just talking about it. But as you can see, the majority of you are really focusing on the middle, on accuracy, which is very important. But do keep in mind that you may have some tendencies as well that you need to keep in check. Okay, so we have this. So I already shared it, right? So sorry, I'm not so
Yes,
stop sharing it.
we saw
Okay.
the
All right. So now to sum it up, a few more poll questions that we are going to now. So based on your experience, let me. You can see the poll, right? I'll just go with that and
yes, it's for a
get the
number
slide.
slide 31. Is it okay?
Yeah, 31, slide
Yes,
31.
yes,
So what
yes,
is, based on your experience, which challenge is most urgent to address in an OSCE? Psychological safety, cognitive overload, or bias, or something else that was not on the list here that we didn't discuss? Okay. All right. Okay, so it's a bit split between all three. And yeah, I think all three are very important to address. So I'm glad that you are all, thinking that they are important things to consider. Yeah, psychological safety is coming out a little bit stronger, and that's of course an important issue. So keep that in mind. I have to share the results. Sorry about that. Do you see the results now?
yes, we can.
Okay, so you see where you are with that. Now, these are most urgent. And now let me ask you the next question. Which of these three would be most challenging? And I'm launching this next poll. So which of these would be most challenging, most difficult to address? Psychological safety, cognitive overload, or bias? Okay. Okay. Can you see the poll?
Yes,
Maybe.
but we
Yeah.
can see the result.
You see the result. Okay, great. Okay. So I can see bias definitely has lots of challenges. And yeah, that seems to be coming out as a most challenging. Yeah, it's definitely difficult, but we're all wired for bias and stereotyping, so we need to work on that as well. So with that, I can stop the sharing. And so you saw the results, right? So I can stop the polling. That's the end of the poll. Then we can go back to the slides. Okay. So let me see here. We went through this already, but I wanted to save some time because I feel we are running out of time. And this here is a poem that was developed about OSCE, called the OSCE Force, and that was a project that was organized by the AAMC to have a poet interview you for half an hour. And then they created a poem about what you talked about. And my interview was about OSCEs. And this was the poem that came out, which presents very much how I feel about OSCEs as a great opportunity to help the healthcare professional training. So I hope whoever is organizing OSCEs in your setting feels the same way. I hope you have a lot of take-home points from this workshop, and please think about it and take some notes for yourself of what you can do in your own work to address these challenging issues. And just to end up with, I want to share some information about the conference that I'm involved in. And I want to thank Rihane for producing this wonderful poster that has become the key image for our conference. So it's in June, and I hope some of you may think about joining as well. It will be about building and rebuilding trust. And I think Rehane's image about the light illustrates what trust, how easy it is, how difficult it is to get trust, to build trust, but how easy it is to lose it. It's a hybrid conference, so it's also online. So with this, I want to thank you all for listening, and we have another minute to maybe answer some questions. Of course, I'm available otherwise too. So
Many thanks, dear Professor. Many thanks for your informative lecture, and as well integrating the art in education by the poem which you made for the OSCEs and the principle and steps of it. It's very great. And today we told about something about integrating art and maybe some storytelling in the education for writing about our information or our scenario for making feeling good in the learners about education. And thank you for disintegrating, and that poem, it's great. It's about the steps of OSCEs, and I have no question. And if our participants have any question, we are here, and they can ask by raising their hand or writing in the chat box, and we have this opportunity to ask them from you.
okay.
Thank you.
Well, I'm glad it was helpful, and I hope you all enjoy the OSCEs that you're organizing. As challenging it is, but it's a very exciting opportunity to do something really good and important for the field.
Yes, absolutely. It's a great tool for assessing the preparation, the amount of preparation of the learning for coming into the real situation as well.
Yes, you're welcome. It's a pleasure.
Yes, Dr. Argaban said, how long do you think? Do you think about what Dr. Argaban asked about how long do you think an OSCE exam should take?
Okay. Well, we've discussed the issue of cognitive overload, and obviously, if it takes too long, people will not be able to pay attention to it. So it varies about the purpose of the encounter. We know in simulation-based learning, a little bit of simulation and a lot of debriefing. So it doesn't have to be long. It shouldn't be too long, but the important thing is that there is an in-depth debriefing of what the learners experienced and what they took away from the training. In terms of an assessment, obviously you need a larger number of stations in order to get a reliable assessment of the performance. But again, you need to keep in mind that people get tired. It's stressful. People get tired. So building in some rest stations would also be important. And there have been some excellent research done about the length of the station. The very first OSCEs were very short, like 5 minutes or 7 minutes or 4 minutes even. But then there was a counter movement to make them much longer, like half an hour, 15 minutes, half an hour, make a very long encounter. But if you are assessing learners for specific skills, the research has shown that 10 minutes is probably the best time, because in 10 minutes you can identify whether somebody can or cannot do a specific skill, will demonstrate the skills. So if you continue on after 10 minutes, you may get more noise rather than being able to assess somebody properly. And OSCEs are focused on specific competencies, on specific skills. So you best off with thinking about 10, maybe 15-minute stations at the most. And I think most of the OSCEs are now about that length. And when we had the licensing exams, I think they were also 15 minutes for the encounter. And then there was a post-encounter probe. So there were some additional questions or writing a chart note or something else that came with it, but that was then separate. So I think that I don't know what is your experience? What kind of stations do you have? How long are they? Have they been, or what's been your experience with the number of stations and the length of them?
She told, thank you very much. I totally agree that the performance of the learner is much lower in long assessments.
Yes, thank you. Mm-hmm.
The sessions are about 10 minutes, the total exam takes long, but she's typing. Yes.
Yeah. I see it. Yes. Yeah, of course. Okay, so one station does not make an OSCE. It's got to be at least 2. And I know in the literature, some articles are 1 station. They talk about an OSCE and they refer to 1 station only. So that's not an OSCE. OSCEs are multiple station exercises or exams. That is the whole idea, to sample performance multiple ways in order to get a appropriate result, a reliable result. So if you see somebody only once in one context, we know about station and case specificity, that's not going to give you a clear understanding of how well somebody can do something. It needs to be multiple times that you examine the same performance. And even if it is a formative assessment and you're doing it for training, you want to expose people to different settings, to different patient scenarios, to different situations in order to make it a more robust discussion afterwards about their competence overall.
That's great. everyone say thanks to you, dear Professor, for wonderful presentation. And there is no question here. Yes.
Well, I'm glad. I would be delighted if it was helpful for you. I love OSCEs, as you will have noticed, and I hope you like them too, as it's a very challenging but a good, important opportunity. So thank you very much for all your contributions to this discussion.
Thank you so much for your informative lecture. And if there is no question, we can stop and end the meeting. And
Yes,
thank again for accepting our invitation. It's truly our pleasure to have you in our webinars.
you're welcome. It was a pleasure for me too.
Thank
All the
you so
best.
much.
Okay,
Yes. Thank you. Thank you. Bye.
sure. Take
Dear
care.
all.
Bye-bye.
Take care. Bye.
Bye.